Look at this creature. This is Xiaohei after a normal, modern workday. 8 hours in a chair, 312 steps. A smartwatch quietly wondering if it should call a historian. Most people treat walking as the smallest possible exercise, the polite cousin of doing nothing, maybe a calorie tax after lunch. And if the number is not 10,000 steps, the day feels scientifically ruined. But biology does not worship suspiciously round numbers. Walking matters because your body is not just a brain being carried around by office furniture. It is a movement-dependent machine. Muscles, blood vessels, joints, hormones, immune cells, and your very dramatic brain all use movement as a signal. So if you start walking daily, 10 things can change. Not guaranteed, not magical, not throw away your medication and become a sidewalk philosopher. Can change. Here is the science. Number 1, your after-meal blood sugar spike can get smaller. After you eat, glucose enters your bloodstream. If you sit perfectly still, your muscles are basically closed warehouses with the lights off. But when you walk, the big muscles in your legs contract. They start asking for fuel. A post-meal walk can help pull some of that glucose out of the bloodstream sooner, which is why research on after-meal exercise finds that walking soon after eating can reduce the glucose spike more than waiting much longer. In other words, your legs are not decorations. They are glucose equipment. Number 2, insulin may get back up. Insulin is the hormone that helps move glucose into cells. In a sedentary day, insulin can feel like the only employee in a very badly managed sugar warehouse. Walking does not replace insulin. It does not cure diabetes. But regular movement gives your muscles repeated reasons to handle fuel. In a 2025 step count meta-analysis, 7,000 steps per day, compared with 2,000, was associated with a lower risk of type 2 diabetes. Associated with, not guaranteed against. Biology is powerful, but it is also annoyingly full of footnotes. Number 3, your blood pressure can ease a little. Your blood vessels are living tissue. They respond to flow, pressure, and the repeated request to move blood through a working body. A Cochrane review found that walking interventions reduced systolic blood pressure by about 4 millimeters of mercury on average. That does not sound like a movie trailer. Nobody screams 4 millimeters and runs through a wall. But blood pressure risk is a long game. Small average shifts matter when they happen across months, years, and millions of very chair-haunted people. Number 4, your heart risk profile can move in the right direction. Public health guidance treats brisk walking as moderate-intensity physical activity. Regular physical activity can lower blood pressure and improve cholesterol levels. And in that same 2025 step count analysis, 7,000 steps per day, compared with 2,000, was associated with lower cardiovascular disease incidence. Again, this is population data. It is not a personal force field. But it does suggest that the heart notices when the body stops pretending the chair is a habitat. Number 5. Your waist and body fat measures can change slowly. This is where the internet likes to become deeply unserious. Walking is not a magic fat-melting ritual. A 10-minute walk does not sprint into your body with a tiny torch. But walking is aerobic activity. Done consistently, it adds energy use, improves fitness, and can support changes in waist circumference and body fat, especially when the dose is high enough and food intake also makes sense. A 2024 meta-analysis of aerobic exercise trials found that at least 150 minutes per week of moderate-intensity aerobic exercise may be needed for clinically important changes in waist and body fat measures. So yes, walking can help. No, the sidewalk is not a wizard. Number 6, your mood and anxiety can shift. This one is not just fresh air fixes everything, which is the kind of advice people give right before being gently ignored. Physical activity can reduce short-term feelings of anxiety. Higher daily step counts are also associated with fewer depressive symptoms in observational studies. The mechanism is not one tiny happiness button. Walking changes arousal. It changes attention. It gives the brain a different sensory environment. It interrupts rumination. It may help regulate stress systems. It is not a replacement for therapy, medication, or real support when those are needed. But sometimes the brain does not need a motivational quote. Sometimes it needs a lap around the block and fewer tabs open. Number 7, your sleep can become more cooperative. Sleep is not just something you do at night. It is negotiated all day by light, stress, timing, body temperature, and activity. Regular physical activity can help people sleep better. Small walking studies have found improvements in some sleep quality measures after daily walking interventions, though the evidence is not a universal bedtime spell. A daily walk gives your body a daytime signal. We moved, we used energy. This is the active part of the day. Then at night, the bed may become slightly less like a courtroom. Number 8. Your joints can become less scary to use. A common fear is that walking will wear the body out, as if knees come with a limited number of official bends. Sharp pain is not something to heroically ignore. Injuries and medical conditions matter. But for many people, low-impact movement is exactly what joints need. Public health guidance lists brisk walking as a joint-friendly activity, and physical activity can reduce arthritis pain and improve function for some adults. The joint is not a porcelain teacup. It is living tissue surrounded by muscles, fluid, nerves, and load-sensitive systems. It often does not want exile. It wants a reasonable job. Number 9. Your immune readiness may improve. Careful with this one. Walking does not give you infection armor. It does not put sunglasses on your white blood cells. But regular physical activity is associated with better immune function and lower risk of community-acquired infectious disease in some research. One systematic review found higher habitual physical activity linked with a lower risk of those infections and changes in immune markers. The best picture is not a superhero. It is a bouncer with a clipboard. Less dramatic, more useful. Number 10. Your future risk curve can bend. This is the big one, and it is also where we must keep our shoes on the ground. In the 2025 meta-analysis, compared with 2,000 steps per day, 7,000 steps per day was associated with lower all-cause mortality, lower dementia risk, fewer depressive symptoms, and lower fall risk. A separate large UK study found higher daily step counts associated with lower incident dementia risk, with stronger associations when some steps were more intense. These are not prophecies. They are not personal guarantees. People are complicated. Bodies are unfair. Life has variables. But the pattern is consistent enough to be interesting. A body that moves daily is sending helpful signals to many systems at once, and that is the hidden trick. Walking daily does not change 10 things because walking is glamorous. It changes 10 things because humans are built out of systems that expect motion. Blood sugar expects muscle. Blood vessels expect flow. Joints expect gentle loading. The brain expects state changes. Sleep expects daytime activity. The future version of you expects today's version to occasionally stop being furniture. So start where you are. 5 minutes counts. 10 minutes counts. A walk after lunch counts. A slow walk counts. A walk that is adapted for your body counts. If walking causes chest pain, severe breathlessness, dizziness, sharp pain, or conflicts with a medical condition or medication plan, get professional guidance. The goal is not to win against your body. The goal is to cooperate with it. Because the daily walk is not a moral test. It is a very boring message to an ancient system. We are still moving. We are not actually a chair. Stay oddly human.